Okay, we are live. How are you guys today? Sorry for the technical issues. I guess I'm having some trouble with my phone again, but I wanted to get on here. Welcome to Cornerstone's Pet Tip of the Week. Dr. Stephanie Stroud here, talking live with you about those nasty ear infections that your baby keeps getting. So summertime, springtime, actually year-round, even in the fall time and winter time, I constantly get questions about ear infections. It seems like you get your pet and it gets hot or it gets nasty, or you take your pet swimming and then your pet gets an ear infection. So then you go to your veterinarian and you get some medicine, and then it seems to come right back after the medicine's done. What's up with that? So we're going to talk all about that. So first thing that I will tell you is ear infections in our dogs especially never tend to be a primary cause. So what I mean by that is typically if your pet is getting an ear infection, that's because there's an underlying cause. And so when we treat ear infections, you have to treat the infection to clear that up, to get rid of the pain and the smell and the itchiness that comes along with the infection, but you also have to take care of the underlying cause that is resulting in the ear infection. Okay, so first off, what are signs of ear infections? What might you be seeing that could be signs of your dog or cat having ear infections? The first one is that they are constantly scratching at their ears, and I say constantly because eventually we'll get to the point of constantly. But if your pet is scratching even more frequently than they normally do, that could be a sign that your pet is getting an ear infection. Other signs is that the ears themselves, when you look down in the ear canal, so that's the hole in the ear, if you lift up that flap in your dog's, or if you look down that hole, it looks real red and angry. Okay. Other signs is that when you touch your pet's ears, your pet reacts in pain. You might see that they're shaking their head, or you might even see that there's a discharge coming out of it, and that may be anything from white, looking like pus, to oily, to brown discharge that can be happening. Okay. So those are all potential signs of ear infections. Now, when we say infection, that is a broad term, okay? There's lots of different organisms that can actually cause ear infections. Anything from yeast to bacteria. When we talk about bacteria, there's different categories of bacteria they can get. So there's what we call cocci, and then there's rods. Okay, so those are actually two different types of bacterial infections they can get. They can also have ear mites, okay? So when you see that your pet is having some of these clinical signs, the scratching, the shaking the head, painful the ears, inflamed, smelling, your first bet should be to take them to your primary veterinarian, okay? Because all those things that cause those ear infections, mites, bacteria, yeast, generally they all require different types of treatment to really clear them appropriately, okay? And so your veterinarian will get a sample of the skin cells and of the discharge, if there is some in your pet's ears, and they're going to put that on the slide, and they're going to look under the microscope so they can tell you and identify what type of infection is present. Or if there are multiple different types, it's not uncommon for me to see both yeast and bacteria in the ear, okay? So those are what the different pathogens that cause, or the different microorganisms that actually cause the ear infections, okay? Now, again, when we talk about ear infections, generally in our dogs, generally not on our cats either, we don't have what we call primary ear infections, which basically means that they just don't get an ear infection for the heck of it. There's usually something underlying causing that. And the most common thing I see is actually allergies, which is why I tend to see, even though I see it year-round, I tend to see an increase in ear infections in the spring, summer, and fall. Because I don't know about the rest of you guys, but I have been going crazy with allergies the last few days because the pollen counts are so high with everything blooming. And so we tend to see a skyrocket in the ear infections as the pollens change, because your pet's actually allergic, okay? And so we tend to see that they have underlying allergies, and then because they have these underlying allergies, their skin and their ears, which are an extension of the skin, tend to get inflamed. and then that inflammation sets up a basis for these other pathogens such as bacteria or yeast to come in and secondarily invade and cause more inflammation and pain. So when we talk about ear infections and you're talking to your primary veterinarian about your baby's care, you want to make sure that, one, the ear infection is actually being addressed appropriately, but you also want to ask them about any underlying causes that could be potentially making your pet more likely to develop ear infections. Because again, if we just treat the ear infections, they're going to keep coming back. That's going to be frustrating for you. It's going to be painful for your pet, and that's absolutely not what we want. So first, best thing you can do is once you see those things, those signs, go to your veterinarian so they can take a look at it. Even if you've had one type of ear infection in the past and you're seeing similar signs, your veterinarian will most likely want to get another sample because you can have different types of infections pop up. And so it's always important that they look at that sample so they can tell you exactly what type of infection they're dealing with so they know how to appropriately treat it because they are different medications. So that being said, I will get off of here. Other things you may look at if you are noticing the ear infections, other things to pay attention to is to monitor if your pet is licking or chewing at their feet or scratching other parts of their body. Those are all other things that would support the underlying idea of potential allergies as the cause of this. But your veterinarian will be able to best help you. Just wanted to give you guys some tips of what to monitor for and to help you guys understand things. So I will get off. Thank you so much for getting on here and watching. I always appreciate you guys getting on here and supporting me. If you want to watch our previous videos, the previous pet tips that we have done over this past year, you can find that right here on our Facebook page. If you just go to the video section, you can also find them on our website, cornerstonevet.info. Go to the About section and then videos, and then it will have all the pet tip videos that we've done in the past year. And then you can also find them on our YouTube channel at Cornerstone Animal Hospital. You can subscribe, and so you'll be updated with one every time that we post one. So again, thank you so much for watching, and I will see you guys next week. Ta-ta.